This is a nice little case. I had a 15-year-old young lady came in, and just a sweet girl, Allison's her name. And anyhow, she had missing maxillary right central. The tooth had been knocked out since she was 8, and she was getting bullied at school. She had multiple flippers made, and they were breaking, and just really just not a good situation. And I've been contacted by a couple of her teachers, and hey, could you help her out? You know, what could you do? So bottom line is, from the lack of the flipper, she ended up having the space somewhat closed, and so there were some treatment hurdles we had to think about. And was this the most ideal treatment for the patient to do direct bonding to fill this area? No, but since the space had closed a little bit, I know I can rely on some good adhesion and some good composite choices, and I'm really not afraid to take on a case like this. So in my mind, I think we've got a good opportunity here to use a total etch, strictly enamel here. So I went ahead and I used a medium grit diamond to lightly roughen the surfaces of the adjacent teeth, and both facially and lingually here. And you can see I went ahead and applied the 34% phosphoric acid etch for 15 seconds and thoroughly rinsed that for 10 seconds. And then created that like suction vacuum tent I talked about to allow that enamel to remain moist. Next, I chose a universal bonding agent, and the one I chose was the One Coat 7 Universal from Coltine. This has a really excellent high shear bond value, and I'll show you some studies on this in a little bit, but it's got a very nice viscosity. It creates, I think, just really nice, can set up some nice aesthetic cases, and it's got the added feature too, it's antibacterial, so I think it's got a lot of nice offerings clinically for any kind of choice that you want to use and do. The other nice thing is it also has a nice affinity for ceramics, composites, and amalgam. So it's got a good, again, that good offering like we talked about with those universal bonding agents. It has some good choices there. It includes that 10 MDP that we talked about as well too. Here you can see the excellent shear bond value, and the column on the very right indicates how this does bond to dentin as well as to enamel in comparison to some of the other bonding agents that are out there in the market today. So I'm very comfortable with this choice and selection for this young lady, and to really create a nice aesthetic and functional case for her to really really deliver a nice smile for her.